have to eat like slaves anymore because we're not slaves. If you cannot control what you eat, then you cannot control what you feel. Eat your largest meals in the middle of the day, not the end of the day.
What part the homeostasis plays, you're on your way to healing yourself. The homeostasis is the internal environment where your body is at its ultimate functionality for healing. Just keep in mind that everything that is happening to you is happening for you.
Hello, Grand Rising. Happy Saturday to everyone. Thank you all so much for joining us here today. You are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. And today's topic is how nutrition is linked to your sexual health. So please share the live, have others be a part of the conversation. I'm sure that we're going to get some great information from Dr. Zarif, as always. So Dr. Zarif, if you can join me here on stage, we can get it started. Happy Saturday to you.
Happy Saturday, everyone, and thank you very much, Kara. It's really great to be here. Let's do some shout outs together, all right? Okay. So let's go ahead and we start with, we're going to give some shout outs to those of you that are here on Instagram, and that's Malika Cox, and is here. And then we have RN Erica has joined. That's beautiful. Welcome. It's so good to see you here. And remember, leave some of your interesting comments, because this would be great. Happy Saturday to family. This is Sweet Pea. Thank you so much for being here, Sweet Pea, in the house on this beautiful Saturday. Okay.
It's her and Eric. So, hey, Eric.
Oh, Eric is in the house too. Okay, cool. Eric. So It's really great seeing you all. Let's go on to what we got over here. And
yes, because we are streaming live on Facebook, on YouTube, and on Instagram.
Okay.
So hello to those over on Facebook and on YouTube. Hey.
Great. So we'll give everybody time. We'll come back to that, and Carrie, you can finish that one up. But you know what we're talking about today is it's very, very important. And this is why, of course, we're actually talking about this today. Did you know that when it comes to the most common STD, or sexually transmitted disease, among Black people, that gonorrhea rates among African Americans 848.8 per 1,000. That's per 100,000. So 848.8 per 100,000 African Americans are more likely to contract gonorrhea, 30 times higher than whites, which is down to a mere 27.9, which is actually high, but is not in comparison to the sexually transmitted diseases of African Americans. Wow. And more than 11 times higher than Latinos. So we always include brown folks with Black folks, but this is guess what? Black folks stand alone in this category, and it's not anything to be proud about. 11 times higher than Latinos. Latinos come in at 75.3 per 100,000. This is absolutely insane, and we have to do something about it.
Wow.
One of the most the common gonorrhea, as we'll be talking about later on, is super important. You know, the results of a young Black man has reported the highest rates of sexual risk and STDs at each wave and across waves. And that's like, we're at really uh, epidemic proportions. And it's not just like, we're, dirty or nasty and all of those things. We just have to change the habits. And that's what we're going to talk about today. What are some of the things that you can do to avoid this? Now, one of the STDs that's the easiest to catch, although gonorrhea is out in front, is herpes. Now, herpes is easy to catch, and all it takes is a skin to skin contact. That's why we have so many people with herpes, and they're like, what the? I didn't even go to bed. I didn't do this. I didn't do that. Including areas that the condom doesn't cover. You're most contagious when you have blisters, but you don't need to pass the virus along. You don't need to be. Sometimes you don't see any blisters, and some people use that as a cue. And we're going to talk about that stuff today. It isn't the easiest subject to hear about, but one of the things that we know for sure is that as we continue to talk about these very important behavior changes, your behavior is is our behavior, and we can change that behavior by making better choices. Okay, and we definitely need to bring that 848.8 per 100,000 down. That's ridiculous. I mean, that's just without any type of discipline or any type of changing of the habits when it comes to sexual health. So before we go any deeper into it, we want to make sure that we have your undivided attention. That's what we really want, because these next couple of minutes go by really fast. We want to share with you this great information, and I think that today, because you're here, we're going to take advantage of giving you some ideas that may be very helpful to you as we move along. So before we go ahead, Carolyn, do you have anything that you want to add or comment?
Just like always, just to share the live, just to be so others can be a part of the conversation. And if you haven't already, please subscribe to the YouTube channel. It is Dr. Farid Zarif. Take it away.
Thank you so much. Before I go right into this, I want to say hello to Nurse Cheryl Lee, Gentle Smart in the house. Thank you so much for being here. Really, I'm glad we have some brilliant people here this morning. And everybody, let's go ahead and dive right into it. So as we go into this, and as you get the information, remember, we're sharing this information so that you will put it in action. Put it in action. Now, we also know that there are people that are married, some people that are truly monogamous, and this will be still great knowledge that you can add on to the discipline that you exert in your relationship. Okay, now as you see here, I was talking about the blisters at first. Now, some people wait for this blister, and you see all in the front of the lip. And excuse me if this is disgusting to you. So I won't leave it up that long, but I just want to give you an idea of what sometimes people are just thinking that, hey, it's just if this shows up or not. Well, this area, this can be on your mouth as a cold sore. There are OTCs that you can buy that are very effective. Other people use different kinds of lysine cocktails. Other people use other over-the-counter or even prescription drugs to um, challenge or to resolve this challenge. Now, the sores, or you'll see the different effects on the body, on the outside, in the vaginal wall, on the penis, and the if a person isn't circumcised, they can also have this in very obviously displayed on their genitalia. Now, when it comes to sexual health, I want to just really clearly say that it's inextricably bound to both the physical and the mental health. And just as the physical and mental health problems can contribute to sexual dysfunction and diseases, those dysfunction and diseases can contribute to physical and mental health problems. Sexual health is not limited to the absence of disease and dysfunction, nor is its important confined to just the reproductive years. This goes beyond that. And sometimes, unfortunately, with all the human trafficking, this happens far before that. Now, it includes the ability to understand and to weigh the risk, the responsibilities, outcomes, and impacts of sexual actions, and to practice abstinence when appropriate. It includes the freedom for sexual abuse and discrimination, and the ability of individuals to integrate their sexuality into their lives, derive pleasure from it, and to produce if to reproduce if they so choose. Now, one we talked about earlier, gonorrhea. Gonorrhea is very popular, as well as herpes, and gonorrhea can be active and still show any. It can be active and still not show any. It can be asymptomatic. I want you to really get that in your head. It can be asymptomatic. No cues whatsoever. There's no display, no clusters, no chancres, no chancroids. There is just one of those things that some people do not show it as much as other people. Now, untreated STDs and SDIs, the sexual disease infections, and the sexually transmitted diseases can result in infertility, especially like if you're getting it over and over and over. And some people are just like, oh, shoot, I just went and took the shot, or I just took a few pills, and then they go back into the same behavior. Well, that same behavior, what it does is it attracts the same results. And eventually, if you're ever planning for a child, well, one thing about infections, they can endanger the health of carrying a child. And then you have those people that just are careless. And what happened is that they cause the same, or they produce the same result because they have the same behavior. Then there's also the pelvic inflammatory disease, along with cancer, miscarriage, and ectopic pregnancy. Then you have the birth defects, chronic liver conditions. All of this is most of this is when it becomes chronic, when you don't do anything about it, you don't go and check out, you don't get a diagnosis, you don't go to a clinic, a free clinic, a hospital. And this is very important to do this. And some people use the excuse of, I was just embarrassed to tell my partner or my partners. Well, you're doing them a favor by letting them know so that they won't spread it. And you'll hear much of the literature that when you're educating yourself on STDs and SDIs is that they'll talk much about the trust factor. Well, that's pretty much out the window if you are having sex with your partner, and your partner's having sex with another partner, and that partner's having sex with somebody else. So you end up having sex with 50 people and don't even know it. And it's really dangerous, as you see. It's very easy to contract. And this is what we want to change. Now, the sexually transmitted infections are spread predominantly by unprotected sexual contact. Some of the STIs can also be transmitted during pregnancy, childbirth, and breastfeeding, and through infected blood and blood products. And that's what I was talking about during the carrying of a child. The child's health can be compromised. So once you have infected blood, remember that you have this infection in all of your blood cells, which is true. There are trillions of blood cells that make up our bodies. The STIs have a profound impact on health. And as we continue to find out more and more about this, as you know, like a lot of people run away from it. A lot of people, they have this cognitive dissonance where you cannot tell them anything about anything. They're going to stick to what they've been doing because this is what gives them the most joy, the most euphoria. Like I said last week, is just that I just want to feel good. Well, you definitely can feel good as you are carrying sexually transmitted disease. But the STIs, which stands for sexually transmitted infections, they, along with the sexually transmitted disease, if the key is to get a diagnosis and to take care of it as soon as possible, not faster. You need to get in and get it checked up and get used to, if you're a very active person out there and you are the community slingaling, or you're the community, I'll say those names, but this is really important that you do something about it, because when you don't do anything about it, it worsens. And as it worsens, it's more injurious. And as it's more injurious, it spreads the disease. Now, some people are actually having disease and they're in pain while they're having it, but the euphoria of having sex over not versus not having sex at all is quite overwhelming. But no matter which term you use, if it's STD or if you're using STIs, we're talking about the same thing. The infections that get passed from one person to another person during sex. That's what we're talking about today. Now, chancroid, again, some of these are very, very hard. This is very hard to look at. Now move on rapidly, because I know it doesn't make your stomach flip out for some of us that are sensitive to it. But there's the chancroid bacteria, and the chancroid bacteria is what produces some of the open sores that you find inside of the mouth, on the tongue, or back by the uvula, sometimes even on the roof of the mouth. This is something that makes your stomach flip out. If you're not taking care of it, it spreads, and it can spread rapidly. Now, some of the most common types of sexually transmitted disease infections include chlamydia, genital herpes, genital warts, gonorrhea, that's also called CLAP, hepatitis B. Now, hepatitis is liver disease, and usually it is affected by bacteria, and that bacteria can be from E. coli, Shigella. It can be from Salmonella. These are the different bacteria that can affect us, and it can be quite injurious and cause other things if we don't take care of it right away. There's also we include HIV and AIDS, the human papilloma virus, HPV, pubic lice, also called crabs, syphilis. Syphilis is definitely expanding. Syphilis used to be something of the past, but syphilis is back and strong. And then we have we have the trick, and the trichomonas is really very, very different. There's different diseases that we can get in these microscopic diseases, and trick, and along with vaginitis. These are some diseases just like genital herpes and just like HIV. These are some of the diseases that one can get that can make life worse as the days go on. Now, those of you that are free-hearted and you can see somebody and start dancing with them, you never met them before, know nothing about them. Their mouth, as you see, this is backed by the uvula. And this is usually, this can be strep, like strep, you heard of strep throat. Well, the streptococcus is very, very dangerous, and you can hide it. You can smile, you can feel good, and have no symptoms. You can see it in the back. Usually there's a burning or something of that nature. It's really very difficult to withstand it. However, it spreads very rapidly. Now, you may ask about how common these sexual transmitted infections are. Sexually transmitted infections are common, and that's because everybody loves sex. Everybody has sex, and there's nothing wrong with having sex. It's like, for those people that really feel that, it's actually a natural thing, but it has been so perverted and it has been so abused that when we say sex, people cringe. It's like, ooh, like who's that a bad word, sex? There ain't nothing bad about sex. If it weren't for sex, we wouldn't be here. So the sexually transmitted infections are common. So we know that there must also be a sexually transmitted infection behavior that's spreading this disease. More than 25 million sexually transmitted infections occur each year in the United States. Yet during the pandemic, one of the biggest complaints was what? I got to get back to the bar. I got to open the bars back up. Like, what? I didn't hear anybody fighting for, we got to get healthier. We got to get our bodies together. So you have, this is a reality. People wanted to, it's nothing like you cannot replace human touch. But when you take it to the point that you're so close and you're so expressive physically, that it can definitely cause a bigger problem. And that's why we're here today talking about the sexual health issues. Now, around the world, an estimated 374 million sexually transmitted infections occur every year. 374 million. That is almost 500 million people that have sexually transmitted diseases and are spreading those diseases. According to the CDC, there are approximately 2.5 million cases of chlamydia, gonorrhea, and syphilis. I'll say it again. There are approximately 2.5 million cases of chlamydia, gonorrhea, and syphilis in the United States. And this was the last report here that I had was in 2021. About half of these cases occur in people the ages between 15 years old, and 24 years old. That is the hot spot there. Nevertheless, younger people also contract these diseases, and older people still contract these diseases. So be sure that, don't exempt yourself from these diseases, because we're all vulnerable to these diseases. Next, we have some of the things that you can see as symptoms would be a discharge from your penis, vaginal discharge that has a bad odor, vaginosis, for instance, causes the irritation or is different color and amount than usual. It's like women may have natural discharges, in other words, but when you start seeing more than usual, then that's when you can suspect that you should be going to get diagnosed. Sexual or a painful sex, and sex should not hurt. So that's something to keep in mind as far as the symptoms: painful urination or frequent urination. Those are another telltale. These are symptoms and cues. In addition, you might also have the symptoms throughout your body, including a skin rash, weight loss, diarrhea, night sweats, aches, pains, fever, chills. You can also have the yellowing in your the eye. So your eye, where the white part is, the white of your eyes, you can have a yellowing there, and that's called jaundice. And you'll see that like when people have, for instance, problems with their liver and hepatic diseases, and that's what jaundice is. Now, what causes these sexually transmitted infections? Are these sexually transmitted infections actually develop when various bacteria, viruses, or parasites infect your body? So you can get these microorganisms from bodily fluids like blood, urine, semen, saliva, and other mucus-lined areas. You can get this especially during sex, usually vaginal, oral, or anal sex, or other sexual activities. Now, I've read the notes on those people that think that, besides some of the risks that you take that's obvious when you have anal sex, can you have anal sex and it be safe? Now, the answer for that are like, there are safe ways. You have to be very clean, and you have to be very diligent in maintaining that cleanliness when you are having anal sex. Now, anal sex, of course, the anus is a sphincter that leads to your rectum, and it is the cut off muscle for stopping or allowing the flow of waste and preferences. I mean, this has been happening since sex has been going on. However, if you're having anal sex, don't take for guys, you don't want to take the penis out and then insert your penis into your sexual partner, because you can infect your sexual partner with that type of behavior. Even if you're using a toy that you are causing, you're gyrating your partner, and uh, you know, some people will take that toy and they'll put it in their mouth afterwards, and that's a part of their sexual expression. They can also use it in the vagina, the same thing, and then they can put it from in one person going into another person, and this is things that are commonly done. There are some people that are probably saying, "Oh no, hell no, that won't happen to me." But if you are going to do that, then there is a special request here. Be very cautious of, remember, the bacteria. That's super important. And yes, sexually transmitted infections, transmitted diseases are contagious. So when you have sex with somebody, especially when you see a person and you start ripping off your stuff, and you drooling at the mouth, and you down to you taking all your clothes off, and or half of the clothes, and you got the panties on the ankle, and you got like a bra in your hand, all of that that is, again, getting back to feeling good. That's euphoria. That's like you're intensified by what is about to happen, or you've warmed up to that. But again, the disease, once you get the disease, the disease is usually there to stay. And as long as you have it, you can spread it. And as long as you spread it, you are dangerous to anybody else that you're having sex with. Now, sure enough, you can reduce the risk by putting on a condom, or there are female condoms now, and there are other different devices that one would use while having sex to reduce some of the risk. But some of the STIs, like syphilis can spread while giving birth to a baby. This is not something that, oh, it's only gonna hurt me for, like, you start calling the shots. You should see a professional and make sure that the professional is giving you a diagnosis, so that you can take that information and do something about it. That means to use the medications and the other instructions that you'll get when it comes to your STIs. Most STIs pass from person to person by sexual contact through bodily fluids, or from skin to skin contact by touching the affected part of the person's body. Usually the genitals are the hot spot. This is where most of the STIs will be. However, when it comes to sex and you're all over the place, there's, you're upside down, you're around, you get the picture. I don't want to gross you out. But the touching of the skin, just the touching of the skin, when a person has sexually transmitted infections, this is super important, that you have to do your due diligence. And I know that it kills the spontaneity of it all, but you'll be so happy when you do take these steps, because then you can reduce some of the things that could happen there. I'm going to, as we continue talking about these different sexual issues and sexual health issues. I'll come back, but I want to go ahead and bring the wonderful Care up now, and we can continue after this.
Thank you so much, Dr. Zarif, and thank you to everyone that's tuned in here. Here in the Mind of Nature. Today's topic is how nutrition is linked to your sexual health. Thank you all so much for joining us. Suzette Storytime for Children, I see you, and thank you so much for joining us here. And James Norman says, great content, Dr. Z. Our young adults need to know this. I agree. Thank you so much, James, for joining us here. And on Instagram, we had All Natural Sister. Thank you for joining us there. Big Boss 5 on Instagram. Thank you for joining us here. If you haven't already, please subscribe to the YouTube channel. We are streaming live on Facebook, YouTube, and Instagram. Dr. Zarif's Dr. Zarif's YouTube channel is Dr. Farid Zarif. So thank you all so much for joining us, and great information as always, Dr. Zarif. You know, I know we in high school, you know, going through sex ed and finding out different things. It's always great to hear the information again, refresher, just to be able to have that information there in you know, in your mind. So as always, thank you so much for this great information that you're sharing today.
Well, you're more than welcome. I mean, I'm really glad everybody's, those people that are taking time to listen to this. This is one of those things that you don't even have to keep on bringing up all the time, because, you know, it's like people are going to find out. If they negate it, it's like, you know, you know, if you negate taking care of yourself, there is a consequence for that.
Yes.
So, yeah, I'm going to go ahead and continue because I think this is really, even in sharing it, is really important. And some of the takeaways from this is that change your behavior. Know who you are in the bed with. Know who they're in the bed with. See, some people feel like they can't enjoy sex without having many partners, and they feel that something is happening different with this partner than the other partner. It's something about, you know, sneaking, stealing, taking that really turns them on. Well, we can really see how very difficult it is, and how I think that people are being abusive. We have celebrities in the news today that are being very abusive. And a lot of those, isn't it something how many people are being discovered to be that have been abusive over decades? Now, I'm not talking about somebody that got an urge after a party and then got in trouble. I'm talking about people that have had uncountable, they have lost the memory of the person's name. They probably didn't know it in the first place. People that have had sex with multiple people because of their popularity. Other things that I wanted to go over with you is that this just doesn't happen where we live. Some of the ranking top cities, some of the cities are, we have Philadelphia, we have Memphis, of course, we have Atlanta. We have Atlanta, by the way, we have more, there are more cases reported of HIV, that Black people having HIV AIDS than any other city in United States. And that's not something to be proud of. This is what we're up against. And those people look good and they got the music on. All of that's beautiful. Is just what we're talking about here is the sexual health, making those decisions that put your body at risk, that put your life at risk. Other cities are Jackson, Mississippi, New Orleans, or New Orleans, Baton Rouge, Montgomery, Alabama, San Francisco. It goes, the list goes on. So I'm sure it's not any surprise to you that we have so many people that negate this. This is good to have this knowledge so that you'll be able to mitigate this any sexual diseases that you have. Now, if you're sexually active, you're at risk of developing a sexually transmitted infection. These are sexually transmitted diseases, meaning that it comes by sex or your genitalia. You can also get the STI if you share personal items like needles that contain your blood. And this may occur in the following instances, like unregulated tattoos, unregulated piercings, sharing needles while using the intravenous drugs. So intravenous means by your capillaries, veins, and that is definitely one of the things that we want to keep in mind, is that these are things that can spread. Another thing, I had a note about the can a person get can a male person get transmitted disease like yeast infection? Well, I've heard this argument before. Many people say that like guys that say I ended up with a yeast infection, and only females can get yeast infection. And you can get most of this. This is not my specialty, but to know enough of it, you don't have to have. It doesn't have to be your specialty in order for you to learn more about it. You don't have to be a doctor to understand that this is the way to avoid diseases. This is the behavior one should have. But getting back to the yeast infection. Yeast infection is a bacteria. So even if, for instance, I had patients that came to my office, and one patient said that she was here with her husband because he was saying that she was cheating on him because he got this sexual disease, and this in this case is yeast infection. Now, she said that, of course, she wanted to get a medication for it, but he's saying that he swears that he has not had sex with anyone. So I'm just going to tell you this because there are other ways that can happen. So don't, start a fight with your significant others. Now, I'm just going to give you one example, but this will also give you the understanding that it's more than just penis to vagina. So if a person, like a guy, for instance, if you're putting on your underwear and you don't have any socks on, well, if your feet are infected, for instance, athlete's feet, if you have the athlete's foot is what it's called. If you have that and you have all the bacteria between your toes, and that bacteria makes contact with your underwear, you can pull that bacteria from your feet up where it hibernates and it migrates from your underwear to your genitalia. And guys, if you want to avoid that, what you do is put your socks on before you put your underwear on. And this can reduce the risk of those communicable diseases, especially when we're talking about yeast infection. Okay, I'm going to just go, let me see, I want to go here. So the management and the treatment, how are sexually transmitted infections treated? Well, the goal of a sexually transmitted infection, and that's again, sexually transmitted disease, treatment is to cure many, not all, STIs. So you want to get rid of as many STIs as possible. That's how you manage it. Because if you don't, it continues and it does more damage, especially the different diseases that, for instance, herpes, the damage that it does on your nervous system is quite is quite impressive. It moves rapidly and it can cause the damage overall, on other parts of your body. You want to also lessen the symptoms. If you have a big sore on your mouth, like a chancroid, one of those huge, and your lip is sticking out, you have to, it's like there, do your due diligence and find out topicals that you may be able to squeeze out of a tube and put it on that area. Again, check with your doctor. Make sure that you're talking to, well, you can talk to a general practitioner, or I rather a urologist, because they specialize in this. Reduce your likelihood of spreading the infection. So you want to make sure, how can you do that? Abstinence comes to mind right away. You don't want to insert your penis into a woman's vagina and she doesn't see it. A lot of it, you got the songs, turn off the lights. No, you better turn the lights on, bud, and make sure that you are with someone that, if you're going to have your body touching their body, skin to skin, if you're going to give them fellatio, or if you're going to do things of that nature with your mouth, then you should know who you're doing what with. But some people get a rush out of that. Some people get a big rush that, I didn't even know her. Or she's like, girl, I didn't know him. But he, and all that stuff. That time out for that, you should be past that by now. And these are some of the things you can do to make it easy on yourself. Treatment for STIs could include taking medications like antibiotics and antivirals. According to the CDC, HIV-infected people should avoid certain foods. Now, earlier, Kara was saying, was explaining that we're talking about some of the sexual health issues and how they're affected by food. So here we'll get into just a little bit, because this can be, it can be all week long. So thank you for your patience so far. I know it takes patience. We're almost there, everyone. I wanted to definitely read this to you so that you will keep this in mind. According to the CDC, HIV-infected people should avoid certain foods to reduce the risk of exposure to opportunistic pathogens, including foodborne and waterborne infections. Foodborne and waterborne infections. That means that the food that you're eating could be infected, and the water that you're drinking could be infected. So cleanliness is important. If you're going over people's house and you just, you're not checking out like the kitchen, the bathroom. If the kitchen and bathroom is messed up, most likely the other parts of the home follows. Some of these foodborne and waterborne infections are raw or uncooked meat, poultry, and seafood. unpasteurized dairy products, unpasteurized fruit juice, raw seed sprouts, foods that may contain raw eggs, such as a certain hollandaise sauce and these different preparations that people use, Caesar dressing, some mayonnaise, and uncooked cookie and cake batter. This is important because uncooked cake batter is in cake batter ice cream, and some ice cream also has cake batter in it. And there's also eggnog can also be deleterious. Sorry about the bad news, but that's the way it is. Okay, next let's look in here. Reduce the risk of the foodborne illnesses so you can also follow safety guidelines. Separate your foods. There's cross-contamination. People still do it. People eat and lick their fingers. People take a spoon and they'll taste what they're cooking and put the same spoon back into it and stir it around. These are some of the things that I suggest to you. I know it spoils your appetite and maybe even your morale, but this is how you avoid that stuff. You want to make sure that your board is clean, and you want to make sure that you clean it periodically with, scrubbing it and soaping it down real good, running super hot water on it, and then using it again. But if you have chicken on that cutting board, you have steak, you have some sausage in the morning, along with other foods, and that those things are touching that other food, then you are increasing the risk for damage or injury to your digestive system and other things. Now, remember you want to eat from the colors. You want to make sure that you're getting from all the different colors, because you have, again, your carotenoids, now you have your polyphenols, your phytochemicals, all of that comes, your terpenes, all of that stuff comes from the foods that we eat. And these are very, very good foods that they can't stop the disease, but what they can do is boost your immune system so it'll be harder for you to contract the disease. Now, this is pretty small, but I'm just going to just read a couple. One, I want to go straight to lutein. Lutein. Lutein is it reduced the it reduced the risk of macular degeneration. That's what you hear most of all. But lutein is very important because it is found mostly in green vegetables, and it is not like a protein. It is more like a nutrient that helps, again, boost the immune system. Then there's lycopene. Now, lycopene is found in the red of that magenta that's found in watermelons. Tomatoes is another, and this helps to reduce the risk of prostate cancer. Again, just like Black people are leading in HIV and AIDS and gonorrhea and in herpes, it's the same thing here, that we also are leading in prostate cancer. The leader of the United States defense, our defense is a brother that he just had to drop out of this position and has been taken over by a deputy, but he also had the cancer. Now, cancer of the prostate is not the same as the benign prostatic hyperplasia. The benign prostatic hyperplasia is the enlarging of the prostate. But when you get prostate cancer, this is when the prostate is taken out so it doesn't spread cancer. This is also means that there are other physiology or functions that now that used to occur but can't occur anymore. It's really important. And then there's Gleason's. There's a whole different approach and a whole different group of challenges that you get with prostate cancer. And also the risk of dying increases. So you have to do that. And if you are under the care of a doctor and you have prostate cancer now, follow those instructions. Don't get comfortable and start telling yourself, I don't need to do this, I don't need to do that. In order to live, in order to have the healthiest life that you can, follow the instructions of your PCP, your principal care physician. Okay, now let me see here. Oh my goodness, we only have 4 minutes. I'm going to have to go back in. I expect that you got something from that. And I knew that this is one of those beautiful subjects. Again, we want you to take away from this some of the things that they're talking about. Remember, load that plate with foods that are colorful. Stop eating that brown plate. It's just brown and no color. It's just beige. Get a plate with a lot of different foods on it, and you'll be glad you did. And all of us want to live. We want to feel. We want to be vibrant. And when you're eating the foods that don't allow you to be vibrant, or it takes from your vibrancy, this is makes it even more important that you eat the foods that treat the body. I'm going to bring up Carolyn. Thank you very much, everybody, for being here. We appreciate you being here. And next week, we'll be back with more. But before we sign off, Carolyn, come on up. Carolyn is somewhere. Let me add you to the stage. There you go.
Thank you.
You're welcome.
I appreciate that. Thank you so much, Dr. Zarif. Great information as always. Everyone, thank you all so much for joining us here in the Mind of Nature. I see Eclipse Soleil. Thank you so much. Says hi, Dr. Zarif and Carolyn. And Chantel, the sweetest piece, says, thank you, Dr. Zarif. This was really good and very informative. Yes, it was. Absolutely. Thank you so much, Dr. Zarif, for always bringing the information to us that we may not have known that we needed at the time, but then it's like, oh, that's a great refresher. So thank you so much, everyone. Have a wonderful weekend. Happy Memorial Day weekend. Be safe out there. And don't forget to subscribe to the YouTube channel. The YouTube channel is Dr. Farid Zarif. Like always, just be safe out there. And I'm just really appreciative for everyone that joined us here today in the Mind of Nature. Just remember, our mission is to bring awareness, listen to your feedback, and now it's time for you to take action. If you know anyone that needed this information, go ahead and share it with them. Share the YouTube channel as well. Thank you so much for joining us. We are here every Saturday, 8 a.m. EST. So, Dr. Perry, do you have anything else you want to add?
Thank you, everybody. Have a beautiful holiday as well. And I want to give up a lot of love, send a lot of love to my brother, Mr. Gento. Feel better. And we love you. And we definitely want you to have a speedy recovery and get back to doing things that you love to do. We also want to send love out to Mrs. Gento. That definitely has her arms around Mr. Gento, keeping him safe and warm, and we really appreciate it. And I want to give thanks to all of everyone that came today. Take this information and help yourself and help your families also. We're about that. We're about being stronger as a community, sharing the information that you can use and using the information that you share. I'm Dr. Zarif, the nutritionist, and
I am Carolyn Gento. Have a great weekend, everyone.
we'll see you next week, 8 a.m. PST. Thank you again.